Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today we welcome Seema Desai. She's a dentist and life coach. Today's KevinMD article is titled Physician Burnout During COVID, Bringing Ancient Practices to Modern Medicine. Seema, welcome to the show.
Thanks so much for having me.
We'll get to the article in a little bit. First off, briefly share your story and journey.
Yeah, so I kind of did the good Indian girl narrative and, went to school, became a dentist. That was my way of getting back at my parents, like not becoming an MD, but a DDS. Married the right guy, did all the things, had the kids. And I was sitting here wondering as I was practicing dentistry, why am I so unhappy? I felt like such a failure. I felt like everybody had it figured out but me. And it led to setting myself up for, I think, a lot of stress and strain. And, at one point I was at a very dark place, which caused me to kind of go on this deep dive into what it is that makes us happy and why. And I always tell people finding yoga quite literally saved my life. But it manifested in other ways in terms of just me being an angry mom and then feeling the guilt about it. And then I would see it in terms of how I showed up with my patients and various interactions all throughout life. And, when I got help for that through coaching, it was life-changing. And, here I am through just following the breadcrumbs and following my passion. Now I get to be an intuitive leadership coach for other ambitious leaders who are trying to figure out how to go from busy and stressed and overwhelmed to productive and fulfilled and happy.
So on the show, of course, we talk to a lot of physicians about burnout. You're a dentist. I actually don't talk to a lot of dentists on the show. So what's it like in that dental burnout space? Are dentists as burned out as physicians are?
Absolutely. First of all, no one really can, it's difficult to grasp the physical toll that it takes on you to be in such a restricted space. My body, even though I haven't practiced dentistry in a few years now, is still feeling the effects and still working to undo the damage that, when you're 25 and fresh out, you think that you're kind of invincible. And so, yeah, I definitely see for dentists, the physical toll is there, the mental toll is there. Of course, then you add on, if you are an entrepreneur and you own your own practice, there's a whole other ball of wax. And so absolutely, while we're just really a subset of the broader spectrum of healthcare. And absolutely, we're right there with you in terms of the physician burnout.
So like you mentioned before, as part of your journey, you went a traditional route into dentistry, but over the last few years, you've transitioned into a life coach and you coach other high achieving individuals. So tell us about that transition.
It was, one of those things where I just realized that continuing to practice for me was not my calling. I found great value in doctoring. I learned a lot. I grew as a person. And I think by the end of my time in the operatory, I really was a much better doctor. And it was a result of really how I was life hacking. And I would have my colleagues tell me these things like, well, this is hard, or, patient care, or this or that, or the kids, or my husband. And, yeah, I want to eat right, but, I just can't seem to get it together. And I was starting to see these problems sort of fall away for myself. And the only difference was me changing my perspective and me understanding, importantly, the bridge between what my body and my breath are telling me, especially in moments of stress. And so really, again, I mentioned I had received coaching myself, and I thought, you know what, I think this is the next right step for me, is to support others that are similar in terms of where they're at in life, because it doesn't have to be hard. It doesn't have to be, I'm not saying that there's not going to be challenges or stresses, but we can absolutely learn to navigate them in a way that's actually going to create even higher successes than we might have previously imagined, all while honoring our well-being, our sense of peace, which is why we kind of tend to work so hard anyway.
Mm-hmm. So let's talk about the KevinMD article. It was written back in 21, which is in the midst of the COVID pandemic. It's titled Physician Burnout During COVID, Bringing Ancient Practices to Modern Medicine. And I'm sure you don't need me to tell you that the ramifications on the mental health, on our healthcare professionals have persisted till now. So tell us how this article came together.
Honestly, I think the pandemic didn't create a new problem. It just precipitated and highlighted very much something that was already pre-existing.
Mhm.
And so, I, I would start to see my husband also, as I mentioned, is in healthcare. He's a physician. Many of our family and friends are physicians, and, kind of looking at things, especially from the Indian American perspective. Growing up, my parents would tell me, especially my dad, do yoga, you should meditate. And it all seemed really woo woo. And it almost created that aversion to
Mhm.
anything that our ancestors did in terms of breathing, diet, how they just lived life in general,
Yeah.
because there wasn't, in my very limited scope of understanding then, a lot of evidence to back that up. So I would just lean into what we practiced and learned here to become doctors. And I started to find, no, wait, actually, you know you become unwilling to look at something until the problem becomes so insufferable
Mm.
that you're like, I'll try anything, right? So that's kind of where I was with, I had postpartum depression with my son, and I was just so desperate to find something. And that's how I kind of reconnected with my roots and started learning about all of the things, all these practices. And once I started to find benefit with that, then turns out there is actually a ton of research, more so now, I think, than before, about why all of these things are actually deeply effective in staving off physician burnout, reversing physician burnout, and importantly, creating an even better version of the doctor you maybe thought you could be.
Now, you mentioned that while you were having episodes of burnout, you reconnected with yoga specifically, and you said that was
Mhm.
life changing. So, talk more about that.
Our bodies, they hold our emotion, they hold our stress. And, I remember being in school and learning about, the parasympathetic nervous system and the sympathetic nervous system and da 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 and vagal nerve. But no one teaches you when you're becoming a doctor how to leverage that.
Hmm.
And I think yoga, while not in medical terms, it is an amazing pathway to help support your body and undo and rewire how things are felt in your body, so that you can actually return to that place of what I call guide thinking, where you're clearly thinking, you're able to see solutions that you cannot when you're under stress. And that's really how yoga helped me, was to initially it was just a workout. It was
Yeah.
just a way to escape.
Yeah.
But when you kind of do it more and more and more, you start to get these lessons of, no, it's more than, it's definitely not about being upside down or twisted into a pretzel, although that is something that I can do now after 12 years of practice. The most effective yoga I do is actually bringing it back to my breath, bringing it back to my mind,
Hmm.
and helping myself understand, all right, what's actually happening for me? Where's my body tensing up when I'm sitting? How's my breath changing? All of those things will just sort of meld together and help you again get perspective that's going to help you get to where you want to go, as opposed to keeping you where you're stuck.
Now, when you talk to other burnt out clinicians, do you incorporate yoga as part of your advice? Like, how do you incorporate that going forward in terms of helping other clinicians?
So I try never to give advice, because what's right for me is not what's right for you. You're the expert in your own life. But I do encourage all of my private coaching clients to start a meditation practice. And if they haven't ever tried yoga, I will periodically do in-person workshops and bring that in, um, just so they can start to see even more so, oh, wow, I never noticed how being in an uncomfortable and new position brought up a lot of the same stresses that running a code brings, or having a difficult conversation with a parent of a patient. All those things kind of tend to show up very similarly. So in my private coaching, it's a lot of breath work, simply
Hmm.
because not everyone has space and time to roll out a yoga mat and do the thing. So what I do practice on in those private coaching sessions are the other limbs of yoga, the non-judgment, the ahimsa, right? The non-violence towards others, but importantly towards the self. How are you talking to yourself in a way that is compassionate, so that you can take that compassion and reflect it outward?
Can you tell us a case study or story? It could be one of your clients, it could be a hypothetical situation where you incorporate some of these ancient practices and really move the needle for that
Mm,
client.
yeah. So I had a client one time who is actually critically see or always sees that the nature of their job is to see critically ill children.
Mm-hmm.
These children are, oftentimes life or death. And, everyone tends to freak out, especially when it's a child. And I don't care how many times if this is your job and you're acclimated to the fact that it's a child, even so, you tend to see your own kids
Yeah.
when those patients are there in front of you. And this one particular client, had given orders and had thought that everybody was on the same page, nursing, the resident, they themselves, and, thought that they had a game plan, basically left, came back to realize, when they went and revisited the patient a couple hours later, oh my gosh, the dosage on this medication was actually 10 times what I had prescribed. You feel like, what the heck? Did you not hear me? Like, I'm pretty sure hello. There's a lot of judgment that can very understandably come into play. And by judgment, I mean black and white thinking.
Mm-hmm.
This is right and this is wrong, right? And there's that expectation that hasn't been met. And so as easy as it was for this particular client to spin out, they were being perceived as unapproachable. They were being perceived as, honestly, people were scared of them. And there's no room for that when you're seeing a patient, whether they're critically ill or not, but especially when they're critically ill. There's no time to be stuck in indecision and fear, right? You've got to have a lot of trust in the team. And so what I was working with this client, basically, they took a lot of what I discussed in the article, right? Having that mindful drive in, setting an intention for your shift, reconnecting with why it is that I'm here in the first place. And so because we had practiced, because we had coached, when things were sort of happening with this particular patient, they took a step back, they breathed, they reconnected with their body, they got a handle, they knew exactly the types of thought patterns that were going to put them into this continued path. And they also knew where they wanted to go instead. And so what happened as a result was, because they were able to have this awareness, they were able to shift and through a process of what I call cross the bridge. And when they crossed the bridge, what happened was they actually were able to approach the situation with a lot of compassion and curiosity. When that happened, not only did they have eye-opening insights as to, oh, these are the things that residents might have sticking points with. Here's how we can fix this and better communicate. Was the issue with nursing and the resident? Or is the nurse afraid to talk to the resident? Is the resident not being clear with the nurse? Or did the nurse see the problem and not feel comfortable and safe to come to the physician? Any one of those things. But it led down a path of curiosity, open conversation. And quite honestly, that pediatric ICU is functioning better than it ever has before, simply because this leader and the partners took steps towards mastering their thoughts and understanding their bodies.
Now, for those listening to you and want to take that first step, and they may think, "Oh, I don't have time to incorporate these." Just give us a sense of how easy or difficult it could be to take that first step.
Easy and hard is so relative, right?
Yeah.
If I told you to put in a central line, I couldn't do it. It would be really hard. So it really just depends on, yes, expertise comes into it, practice comes into it. But the reality is, how long are you willing to make yourself wait for the better version of you, the best version of you? It's really up to you. It's really about how invested you are in making the change happen for yourself. And that's why working, books are great, podcasts are great, because they can give you insight. But if you're not going to take that insight and put it into action, you're not going to see a change maybe as quickly as you would otherwise. And that's why, at least for me and my clients, working with a coach myself and me working with my clients, that's why it's so powerful, is you have the accountability, you have the support, you have the clarity. So you know exactly what you're going to do, why you're going to do it, how you're going to do it. And you just get to experiment in the best way and watch life unfold.
We're talking to Seema Desai. She's a dentist and life coach. Today's KevinMD article is titled "Physician Burnout During COVID, Bringing Ancient Practices to Modern Medicine." Seema, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Well, first of all, I would say having compassion for yourself and how you talk to yourself. How you talk to yourself is exactly why you're living the life that you have right now, whether that's in finances, the relationship with your spouse, the relationship with your kids, the relationship with your patients, your team. And so I think that was the biggest thing when I started out. If I could go back and tell myself anything back 20 years ago, I would
Yeah.
say, really take the time to understand how it is that you're speaking to yourself, because that's the lens through which you're making the decisions that are creating the reality you're living right now. So you basically are living the life that you've chosen to live. And if it's not one that you want to live, instead of blaming the system and yes, the system is broken, yes, this, that, the other, and we have incredible power to choose our own thoughts and which ones we believe, which ones we take action from. So I just want to empower you guys to recognize that you do have that power. You do have every capacity to create anything you could ever want, have, or need, and it's right inside of you.
Seema, thank you so much for sharing your perspective, time, and insight. And thanks again for coming on the show.
Thank you so much for having me.